Village women are expected to produce 3 more children in comparison to their urban counterparts. In the preliminary 2011 Uganda Demographics Health Survey, urban women are expected to give birth to 4 kids throughout their reproductive life, compared to the 7 children for the rural women, who contribute 85% of the women in Uganda. 25-year-old Robina Nanyanzi, a resident in Kayunga district, is such a woman. Seated here with 7 children, all hers and her husband's Stanley Mwonge, a jackfruit vendor. But the family is not yet complete. The oldest child, number 8, is returning from the garden. Robina delivered her when she was not even a teenager, at the tender age of 11. She is lucky not to have died during pregnancy, at childbirth or after, because throughout her teenage years she has been giving birth. It is no wonder that she looks older than her years. Some women have, however, not been as lucky. Globally, approximately 500,000 women die every year from complications due to pregnancy and childbirth. In Uganda, we lose about 6,000 a year from complications such as bleeding, unsafe abortions, high blood pressure, infections and obstructive labor. Others are due to anemia, malnutrition, HIV and AIDS and malaria, accounting for 19% of maternal deaths. And these deaths continue to happen for a number of reasons. Despite the fact that 50% of Ugandans live within 5 kilometers of a health center, many women in remote areas still find it hard to access any medical care. The urban woman can easily access a health facility. Robin has had to walk for about 3 hours to access a health center. Other women don't bother. They stay at home and use traditional birth attendants or friends and family. Something very dangerous, as these are not skilled, trained health workers. How is maternal health worldwide? How is it being handled? Where are we?
Well, I have to say that the good news is that it's coming down. The mortality of it is coming down. But we still have a long way to go. Still have a long way to go because, you know, what results in maternal mortality is a complex set of issues. It's not just one.
On a positive note, according to the indications from the 2011 UDHS, we are seeing 6 out of 10 women going to health facilities to deliver, which is an improvement from years gone by when about only 3 out of 10 went. The Executive Director for United Nations Population Fund UNFPA, Dr. Babatunde, asserts that a measure like prevention of mother-to-child transmission of HIV has gone down well so far.
And if we are going to get to 0, that's one that we can do fairly quickly. We know what to do. We know how to do it. We have the technologies. And it's just a matter of being able to ensure we reach all pregnant women and provide the services we have to provide.
But a lot more needs to be done, and he affirms that integration is the way to go.
Let us make sure that it is antenatal care, it is, PMTCD counseling and testing, it is family planning, it is delivery services and immunization, so that you have everything in one-stop shop and that the woman can go back and forth and get all these services at the same time, because it doesn't make sense for her to go for just PMTCD services and then she doesn't get, the rest of her antenatal care.
With the conversion of the Interparliamentary Union Assembly in Uganda, our parliamentarians may have to direct further attention to maternal health as one of its top agendas.
If we're able to reach parliamentarians and they understand, the responsibilities that, they carry, I'm sure that we can get a better hook in terms of advocacy, in terms of resources, and in terms of policy.
Maternal health issues are still underreported. Many media houses disregard them, but there are a lot of issues to be raised. It is 3 more years to account for what each country signatory to the Millennium Development Goals has achieved. When we continue to have a high unmet need for family planning, it is unlikely that we'll be giving an account of what has been achieved. The contraceptive prevalence rate CPR has increased to 30% from 24% in 2006. Many women like 25-year-old Robina have no say over the children they have. The man decides. Demand for children is still at 53% since 2006. For some women, they have no knowledge of what methods to use. But even if the CPR were to increase by 2015, it won't surpass 35%. 2015.
Oh, 2015.
Setting 2015 as, something to say that we've achieved this.
HIV, AIDS, the TB and malaria are receiving considerable attention. So I believe that the momentum we've created, we should carry it forth. But of course, the work will not stop and will not be finished in 2015. So we have to keep going and ensuring that we give visibility to these issues because they are central to human capital development and human development generally.
Florence Naluyimba, NTV.